Hi, everyone. I'm Nicky Stanley. I'm a professor of social work, researching in the Connect Centre at the University of Central Lancashire, which is up in the northwest. I'm really pleased to be here today because I want to draw your attention to the call for evidence, which has just gone out for our new study, Dahlia 19. Dahlia 19 is a study looking at policy and practice responses to domestic abuse under COVID-19 in 4 countries. That's the UK, Australia, Ireland, and South Africa. And we're drawing on the global nature of the pandemic to bring together learning about what has been effective at both the policy and practice level in responding to domestic abuse under COVID-19.
Lovely, thank you. So I wondered if, just to begin, you could give a little bit of background with regard to the motivations for your study and the broader impact of COVID-19 on survivors and children who are currently living or have been living with domestic abuse.
Yes, a key experience for women and children who are living with domestic abuse in other times, normally, is one of restriction and constraint. Their freedom of action is drastically reduced, and the home is not the safe and secure place that it should be if you're living with domestic abuse. COVID-19 has intensified that experience and drawn the walls even tighter, with opportunities to leave the home reduced, abusive partners spending more time at home, and access to support limited. Essentially, women and children are spending more time in an increasingly unsafe space. So our project is trying to look at the various strategies that have been deployed at both policy and practice levels to assist both survivors of abuse, their children, and also to continue to assist perpetrators to change their behavior during COVID-19. And to do that, we need the assistance of all of you, both in the domestic abuse sector and beyond, to respond to our call for evidence and to tell us about the initiatives that you've encountered during the last year.
So, as you say, your study will focus on responses to the increased risk of domestic abuse in the UK, Australia, Ireland, and South Africa. What do you see as the key differences between the approaches taken in these countries?
Okay, well, we chose those countries because they're all countries that have domestic abuse services, but they're at different stages of development. And responses to COVID-19 have built on existing conditions and infrastructure. So, for example, we might expect the shift to delivering services remotely to have been smoother in Australia, where there's already considerable experience of delivering domestic abuse services remotely. You know, Australia's got this vast, rather empty interior, and there's quite a bit of experience in how you deliver services to people living outside the large cities. Attention to ensuring access to digital technology for survivors and their children may well have varied across those countries. And one of the things we've started to hear about is that access to that digital technology may be very important in facilitating routes to safety. South Africa is a very interesting country. What we're learning from our partners there is that the majority of the population are already living in very crowded conditions. So for them, retaining access to public spaces is really important. And that actually may also be true for some communities in the UK. So, you know, you can see some transferable learning going on already.
So, in your opinion, looking at all of this, how can different stakeholders, for example, local government, the Home Office, the police, how can they better work together to ensure the protection of survivors? And how important is the role of state infrastructure, such as refuges and housing, in supporting those who no longer feel safe in their homes?
Okay, well, these are key questions that our study is going to be addressing. We're just starting out now. So, again, I'll encourage you to respond to our call for evidence, which is open until the 19th of March. Our study is looking, as I said, at both policy and practice responses to all family members, that's survivors, children, and perpetrators. And we want to look at the extent to which responses have been coordinated and joined up. We know that the Domestic Abuse Commissioner, Nicole Jacobs, has worked really hard to encourage the domestic abuse sector to communicate and collaborate under COVID-19. And that's also happened in Scotland and Northern Ireland to some extent as well. What we know less about is the collaboration between sectors, and clearly the work of other sectors such as health, education, housing particularly, and of course the police and the criminal justice sector are going to be really important. And I'm sure you're going to be hearing in your event today a lot about the knock-on effects of the slowdown in the court system and what that's meant for victims of domestic abuse. So this is the sort of information we're looking for in our call for evidence.
Okay, lovely. I just wanted to ask quickly, because as you said, the study will look at the impact of domestic abuse both on survivors, children, and perpetrators. Would you just be able to expand on why it's so important to include children in a study of this nature?
Well, increasingly, we know that, domestic abuse does affect children. What we know already about children's position during the pandemic is those children at risk of harm in the home have had much less access to the sources of help they would usually access through education. And concerns have been expressed that, many of those children who teachers feel would benefit from being in school during the pandemic haven't been there. So there are real concerns about children in need at the moment. What this study is particularly going to look at is those who are in need as a consequence of domestic abuse in the home.
So as you say, I know that you're currently in the early stages of your study. However, I wondered if you could just share your thoughts, your own thoughts as to the way forward in this area. I mean, as we're now in our third national lockdown since the beginning of the pandemic, what lessons do you personally believe that the government should take from the experience of domestic abuse survivors throughout this time?
Okay, well, our study is going to be interested both in top-down but also in bottom-up responses. And, we hope that government will be interested in the bottom-up responses and the learning available from those, as well as what the assessments are of the top-down responses. One point that our UK stakeholders have already made is that the government and public health messages that have specifically identified victims of domestic abuse as people who can leave the home to access support have been really useful. They've been useful in two ways. They've been useful for victims, but they've also been useful in raising public awareness of domestic abuse.
Lovely, thank you so much. It's been really interesting to speak to you this afternoon, and we really look forward to seeing the results of your study, as I do think it's such an important contribution to an area like this. But yeah, thank you so much for your time and for sharing your insight. It's been a pleasure.
Thank you, and have a good day, and do respond to the call for evidence, please.
Thanks.